Beth Johnson. I'm here to present to you today about coping with compassion fatigue for occupational therapy practitioners. In order to ensure flow throughout the presentation, I will not be reading the authors in the in-text citations. If you would like to know where any of this information was obtained, you can see it in the PowerPoint slide with the in-text citations as well as the references. There are two items that I would like for each of you to complete before you begin the course. First of all, there is a pre-test symptom checklist, and what this is going to do is allow you to identify any symptoms of compassion fatigue that you may be currently experiencing. Then I would like you to complete the pre-test knowledge test, and what that will do is just give me an idea of your knowledge base about compassion fatigue prior to completing the course. If you would complete both of these before beginning, and pause the video while you complete them. There are several learning objectives for this course. After completing the course, you will be able to find key terms related to compassion fatigue, including compassion fatigue and burnout. You will be able to develop a self-awareness of the symptoms as well as the factors that lead to the development of compassion fatigue. You will be able to describe the negative effects of compassion fatigue and what it can do to the OT practitioners, the clients, and the organization. You'll also be able to identify self-care activities that can be included in a self-care plan that can be used to combat compassion fatigue. You'll be able to implement coping strategies to prevent and treat compassion fatigue. And you'll be able to design an individualized self-care plan to be used in the future to prevent and or cope with compassion fatigue. Compassion fatigue is defined as the decreased capacity to demonstrate empathy due to the distress or trauma that a client may have experienced. Compassion fatigue is also known as the cost of caring. It often happens when a practitioner becomes emotionally saturated. And the term compassion fatigue is actually something that began as a nursing term. It was first coined by Carla Joynson in 1992 to reference nurses who were experiencing burnout and who had lost the ability to really nurture their clients the way they would like to. Compassion fatigue includes the emotional, physical, cognitive, and behavioral drain or exhaustion that can occur in helping professionals secondary to the demands of the job. This compassion fatigue makes it more difficult to empathize with clients. The overwhelming amount of emotional energy that is needed to provide care for clients drains the practitioner's stamina. Since the practitioner must also cope with the stressors of their own daily personal life, this combination increases the possibility of burnout and compassion fatigue. In addition, an imbalance may develop that skews the practitioner's focus from their personal life to their professional life, which then reduces their overall quality of life. Secondary traumatic stress occurs when the caregiver or the practitioner observes the anguish of others who have experienced trauma or distress. Oftentimes, the caregiver or the practitioner begins to feel some of the same symptoms as the person who experienced the trauma. For example, after working with a veteran with combat-related post-traumatic stress disorder, or PTSD, the therapist may become anxious in crowded public places, similar to the experiences that the clients have shared with them. Many people use the terms burnout and compassion fatigue interchangeably. However, there is a difference. Burnout often causes anger, frustration, or pessimism towards other individuals. Compassion fatigue results in sadness, nightmares, and oftentimes results in disengagement or separation from other individuals. Compassion fatigue can result in many psychological or emotional symptoms, as well as physical symptoms that you end up having to deal with because of the compassion fatigue. Some examples of those that you'll see listed here: feeling overwhelmed, being disoriented or confused, having trouble concentrating, possibly becoming irritable or agitated, having an increased sense of anxiety, maybe being disinterested or avoiding other people, possibly having difficulty feeling empathy or having relationship disturbances. Then there's also physical symptoms such as shortness of breath, heart palpitations, muscle tension, headaches, digestive issues, fatigue, and sleeping issues, including insomnia. So the signs and symptoms listed on this slide came from a variety of resources, as listed at the end of the slide. These signs and symptoms may impact the practitioner's work performance, resulting in potential absenteeism, diminished work performance, tardiness, and the overuse of sick days. When considering the factors that contribute to compassion fatigue, one has to look at the organizational factors that contribute. Those include increased job demands like productivity requirements, workload expectations, work hours, and caseloads, as well as documentation expectations, high pressure for improved client outcomes, poor or difficult working conditions, lack of supportive supervision, poor wages, and job insecurity. Compassion fatigue is often seen in health and human service providers and other helping professions such as teachers, nurses, social workers, mental health service providers, hospice care workers, and first responders. It's also higher in professions where employees are frequently exposed to negative emotions from their clients. Conflicts between clients and their families is also a professional risk factor for development of compassion fatigue. During the process of evaluating and treating clients, OT practitioners often listen to stories of very painful or traumatic events. These stories bring potential for development of compassion fatigue. OT practitioners give empathy and sincerely engage with their clients. This makes exposure to client experienced trauma unavoidable during OT service delivery. There are also individual factors that contribute to compassion fatigue. The prevalence of compassion fatigue is higher in people who closely associate their personal identity to their professional position. Also, practitioners with a greater capacity to provide empathy to their clients are at a higher risk for compassion fatigue. Then there's emotional intelligence levels. Individuals who are emotionally intelligent can manage their emotions more effectively by using coping strategies that increase engagement and decrease stress. Those with low levels of emotional intelligence often utilize unhealthy coping mechanisms, such as avoidance, which increases fatigue and potentially increases stress. Additional personal characteristics that we should consider when thinking about the things that contribute to the development of compassion fatigue. We also need to think about the person's ability to process information. We also need to think about their ego defensive process, which is an unconscious psychological process that helps the person to deal with anxiety or negative feelings that may come from an internal or external environment of whatever sort. That could be anything, including your patients and your clients and their trauma that they bring to the table when you are working with them. Some of the other things are considering the effects of stress on the individual, as everybody deals with stress differently, the person's ideological beliefs, their coping ability, as well as their stress management techniques. If the healthcare practitioner has a personal experience that's related to the trauma that's being faced by the client, then the likelihood of that practitioner developing compassion fatigue also increases. Compassion fatigue can impact many things in many different ways. It can negatively impact the practitioner's professional judgment, as well as their ability to provide quality services to their clients. It may cause a lack of attention provided to the client, which may result in decreased client-centered care and decreased morale within the department. It may also result in decreased client satisfaction with the care that's provided to them. Compassion may also be costly to the healthcare organization, and at the organizational level may negatively impact overall client outcomes, attrition, and the overall quality of life of the OT practitioner. And as we know, if the quality of life of the practitioner is a problem in employees within an organization, oftentimes there is high turnover. Once an OT practitioner has identified that they have experienced or are experiencing compassion fatigue, the goal is to then develop coping strategies. And the ultimate goal in having positive coping strategies is to achieve compassion satisfaction. Compassion satisfaction is a sense of fulfillment about the work that's done by a practitioner, and it is based on feelings of hope, strength, and resilience. We also hope to develop resilience in using these coping strategies. It's important to keep in mind that there are 4 components of resilience, including proper sleep, healthy diet, regular physical activity, and active relaxation. Resilient practitioners can balance multiple roles and tend to see challenges more as opportunities for growth and learning instead of seeing them negatively. OT practitioners should aim to achieve a work-life balance, enabling them to invest time and energy in caring for themselves. It's imperative that healthcare practitioners find times for themselves each day. Boundaries must also be established. A self-awareness must also exist in order to achieve compassion satisfaction, to achieve work-life balance, and to establish those important boundaries. It is important that we remember that one of the most critical steps in getting help or in coping with compassion fatigue is self-awareness. That self-awareness can be achieved either through an informal daily self-check-in that can be used to just assess the tension in the body, the anxiety in the mind, and looking to see if we're feeling anything that resembles compassion fatigue. Self-awareness may also be achieved using a more formal self-assessment that may help to identify any underlying issues to determine the need to seek additional help. One of the most commonly used tools to assess compassion fatigue and compassion satisfaction is the Professional Quality of Life Scale. You can find this scale at the website below that's linked in the slide. If you would take a moment and review or complete the ProQOL before moving on to the next slide. Once you've completed the assessment, take a moment to reflect on your score. What did you discover about yourself that you didn't already know? Please feel free to pause the presentation while you're doing the ProQOL. Now that you have developed a self-awareness by completing the ProQOL and by learning about the signs and symptoms of compassion fatigue, it's important to think about what you can then do to cope with this. So self-care has been reported as one of the most significant strategies to prevent the development of compassion fatigue. In the upcoming slides, we will further discuss the toolbox that each of you already have in place, as well as strategies you can add to your toolbox to decrease your compassion fatigue and increase compassion satisfaction and resilience. Take a moment to think about the strategies you already have in place and the potential need for more strategies. Please pause the video if you would like additional time to reflect on your current self-care strategies. A self-care plan is something that you can use in order to make sure that you're providing the appropriate amount of attention to your own self-care. A self-care plan should address 6 main areas: physical, psychological, emotional, spiritual, professional, and relational health. Remember, a self-care plan is meant to be a personalized toolbox that may include daily practices such as gratitude and reminding yourself of your purpose. Also, please remember that your self-care plan is supposed to be very unique and individualized. Your self-care plan should also address each of the 4 components of resilience. And remember, those are proper sleep, healthy diet, regular physical activity, and active relaxation. It's important to remember that taking care of yourself is not being selfish. It's impossible to successfully care for others if the practitioner's cup is empty. It's necessary for practitioners to demonstrate self-compassion, just like they provide compassion to their clients. Remember, it's not always productive to always say yes to others while saying no to your self-care. There are many options for self-care that can be utilized to ensure that you are able to take care of yourself in a way that works for you. There are quite a few ideas listed here. These self-care ideas were obtained from a variety of resources, as you can see listed at the end of the slide. And as you can see, there are self-care ideas that meet each of the areas that we've spoken about for resilience. So there's establishing a healthy diet or utilizing mindful eating, and then doing things like participating in an enjoyable physical activity, finding ways to relax by maybe establishing a new hobby. There's also things that you can do at work, like taking adequate work breaks or taking vacations when you need them. Those are important as well. You can also work on establishing a support group or a peer support group at work. So there, as you can see, there are many options here for self-care that you can utilize in your toolbox. Peer support and gratitude journaling are two options for self-care. With your peer support and your gratitude journaling, those things can occur in person or they can occur remotely. As you can see here, the third bullet is labeled Jamboard. If you feel comfortable, please open that Jamboard that's linked to the slide. To open it, all you need to do is click on the link in the PowerPoint. Once the document is open, if you feel comfortable, you can share some challenges that you faced as an OT practitioner, something you are thankful for, and some self-care activities you currently participate in. That may end up helping one of the other practitioners that complete this course that see the activities that you share. So each of the slides in the Jamboard are labeled with one of those questions to show which one should be answered on that page. Then to share on the Jamboard document, all you need to do is click on the icon on the left that looks like a sticky note. A small screen will pop up. You can choose the color background you want, type your answer on that small screen, and then click Submit. Your response will then appear on the Jamboard document, and it'll look like a little sticky note. I encourage you to reach out to other OT practitioners who understand what you're experiencing, whether it's virtually, like something like the Jamboard, or whether it's via telephone or in person. It's helpful for you to establish a peer support network so that you know that you're not alone. These techniques can be used to bring the individual that's participating into the present moment and makes them self-aware without judgment. A possible coping strategy that can be used in your self-care plan is various types of mindfulness techniques. Oftentimes, people who are unfamiliar with mindfulness techniques think that it takes a large amount of time or that they have to sit in a certain position. However, mindfulness can be completed while doing the very most basic thing, breathing. Mindfulness can also be included in most of your daily activities. It can be completed in a mindful way. For example, you can utilize mindfulness practices while doing a basic ADL, such as brushing your teeth or eating. You could also use mindfulness while walking. Before we begin this first mindfulness practice, I would like to acknowledge that mindfulness takes time and practice. It's definitely not a quick fix. However, it can help you in the long run if you commit to practicing the mindfulness techniques that you learn. So if you're willing to participate in the mindful walking activity, you would take a walk through your neighborhood or on a local beach or whatever location that you prefer. As you're walking, try not to allow your mind to move through other thoughts. Try not to think about your day at work or what you have left to do later. Just notice your surroundings. What do you see? What do you hear? What do you smell? What does the ground feel like beneath your feet? How are you feeling as you walk? Are you out of breath? Are you feeling energized? Do your best to remain fully in the moment, taking in everything around you. In order to participate in this exercise, all you need to do is get your favorite snack food, give 5 to 10 minutes of your time, and come at this with an open mind. So I would like for you to begin by connecting to your breath and body. Feel your feet on the ground and notice what you're feeling, seeing, hearing in this moment. With your awareness in this moment, notice any thoughts, sensations, or emotions that you are experiencing. Tune into the awareness or sensation that you have in your body. Do you feel hungry, thirsty, or full? If you were going to eat or drink something right now, what is your body hungry for? What is it thirsty for? Be aware of the sensations within your body that provide you with these cues. Now bring your attention to the food of your choice in your hand and imagine you are seeing it for the very first time. Observe with an open mind as you pay attention and notice the color, the shape, texture, and size of the food. Is there anything else that you notice, sense, or feel as you're looking at it and holding the food? Imagine what it took for this item to get to your hands. Sunshine, water, time, processing, and shipping. You may choose to be aware of gratitude for everyone involved in the cultivation and preparation of this item of food. You may choose to bring in your own gratitude or spiritual blessing. Now place the item between your fingers and feel the texture, temperature, and ridges. You may notice smoothness or stickiness. Again, take notice of any thoughts, sensations, or emotions you are experiencing. Continue to breathe and be fully present in this moment. If something else comes into your mind, acknowledge it and then refocus on the item in your hand. Now take the piece of food and bring it towards your nose and smell the food. Notice if you have any memories, sensations, or reactions in your body. Even before you eat it, you may notice that you begin to have a digestive response in your body just by noticing and smelling. What, if any, are those responses? Feel your hand going towards your mouth. Are there any thoughts that happen while completing this movement? Place the food into your mouth without chewing or swallowing it. Just allow it to be in your mouth. Roll it around to different parts of your mouth and tongue. Notice the flavor and texture. Notice the physical sensations within your body, especially your mouth and your gut. Be aware of how having this item in your mouth is making you feel. How is your body responding? Next, take just one bite and notice the flavor. Notice the change of texture. Then very slowly begin to chew this piece of food and notice the parts of your mouth that are involved in the chewing. Notice the sound and the movement of the chewing as you continue to notice the sensations and flavor. When you are ready, swallow this item and notice the path that it follows from your mouth and throat into your stomach. Notice the sensation and the taste that may linger in your mouth. Connect again to your body and your breath and notice your experience in this moment. Next, I invite you to take another bite of your chosen food item. This time, eat it however you wish. Notice your choice and how you eat changes your experience. Notice how it's similar or how it's different to when you ate the bite mindfully. Now that you've completed the mindful eating exercise, how did it feel? Did you relax? Did you enjoy your food more? Describe your experience in a few sentences. Do you feel that you could use this technique as part of your self-care plan? If so, please add this to your self-care plan toolbox. In addition to the opportunities that we have as practitioners to combat compassion fatigue, there's also a role that the supervisor plays in preventing and coping with compassion fatigue. These things include having an increased awareness of the signs and symptoms of compassion fatigue, allowing the supervisors to provide timely support, and provide the knowledge needed to appropriately modify organizational factors that lead to an increase in compassion fatigue. Supervisors may use strategies to prevent compassion fatigue among their staff members, including scheduling regular meetings where staff members can voice their concerns, regular training opportunities, peer support groups, and encouraging staff to take appropriate breaks. There are also opportunities that the organization can provide to help to cope with or prevent compassion fatigue, including providing art therapy, massage sessions, tranquility rooms, and reward and recognition programs. So let's think a little bit about compassion fatigue and what it may look like in a real person. Meet Frances. Frances is an occupational therapist in an inpatient psychiatric facility. Frances provides individual and group treatment in this facility to her clients. She often hears and reads stories of domestic violence, abuse, and other traumas her clients have experienced. Frances has started to notice that she's having difficulty concentrating at work. She's irritable, and the anxiety that she thought she had conquered a few years ago has started to return. She has muscle tension in her shoulders, and she's dealing with insomnia. She's noticing that it's harder to feel empathy towards her clients. Currently, she's feeling unfulfilled with her work. She often feels that she's alone in her struggles. Recently, the rehab manager met with Frances to discuss her recent increase in utilizing sick days. So based on the description of Frances, do you believe that Frances has compassion fatigue? If so, what symptoms did you notice that Frances is exhibiting that leads you to believe that she has developed compassion fatigue? Some of Frances's symptoms that we noticed in the case study include difficulty concentrating, irritability, anxiety. It was harder for her to show empathy to her clients. She was feeling unfulfilled at work. She was noticing muscle tension and insomnia. She was also utilizing increased sick days, which was noticed by her rehab manager. So what are some coping strategies that you think will be best for Frances based on the case study information? Possibly meditation practices to help with sleep. Maybe an exercise routine that she will begin. Possibly adjusting her sleep schedule. Some other options may be a peer support group at work, or doing gratitude journaling, or maybe even speaking to her boss about a rewards or recognition program. Are there any others that you can think of that we've learned about thus far in the course that may help Frances? The awareness of compassion fatigue is crucial in executing future programs meant to reduce compassion fatigue. Awareness of various challenges and barriers encountered by OT professionals will better inform employers and managers regarding how to improve working conditions and increase compassion satisfaction. As many of you already know, many organizations we work in often do not allow the space or time needed for mindfulness practices during the workday. I believe there is a need for an organization level change. Perhaps we can use this opportunity as a call to action to bring awareness of compassion fatigue and the appropriate strategies organizations can use to ensure healthy practitioners. So our call to action is really because of the practitioners that are often feeling bogged down by the system, worn out, and overwhelmed by their workload. This indicates that this is something that can be worked on at an organizational level, which is where we come in. we can advocate to our employers to prioritize the health and wellness of the employees. According to the preliminary findings from Hahn and Popova, practitioners who perceived their employers as prioritizing their health and wellness reported lower scores on the perceived stress scale and higher scores on the professional identity questionnaire, the professional quality of life scale, and World Health Organization's well-being index. On the PIQ, practitioners also reported a clear understanding of the OT role and values. So when employers prioritize the health and wellness of their employees, that may mean doing things like providing them with time and space to participate in mindfulness exercises. That may also mean providing a course like this one to educate the staff and supervisors on what compassion fatigue is and how they can cope with it. It may also include recognition for the employees' hard work. In addition to the call to action at the organizational level, there are things that we can do on the personal level to also combat compassion fatigue. Take a moment to reflect on each of the self-care activities and coping strategies discussed in this presentation. What activities could you include in your personalized self-care plan? Please pause the video if you would like additional time to document the activities that you hope to include in your personalized plan. There are several resources that I've included that you may choose to use to help you in your process of creating your self-care plan and utilizing these tasks or these activities to help you cope with compassion fatigue or to prevent it. So there is the Greater Good in Action. It's a website that provides science-based practices for a meaningful life. It includes various meditations for relaxation and motivation, as well as compassion and self-compassion exercises. There's also the ProQOL website, which includes the assessment as well as other self-care tools that are recommended. There's also a mindfulness resources website called freemindfulness.org. And then there are mindfulness apps like Calm and In the Moment and Mindful Eating. There are also many other websites and apps out there. These are just the ones that I chose to utilize in this presentation. If anyone has any questions, please feel free to email me at hejohnsonot@gmail.com. You'll see my email address listed at the bottom of this slide. I would love to hear from you and answer your questions, as well as hear any feedback that you would like to provide via email. Here you will be able to see the references that were used for this presentation on this slide and the next. Before completely concluding the course, I would like for each of you to complete the post-test symptoms checklist, the post-course knowledge test, which will give me an idea of how your knowledge increased from before the course to now, and the participant satisfaction questionnaire. In this questionnaire, you will be able to provide your feedback on the effectiveness of the course, as well as your satisfaction with the information offered. I would like to thank each of you for taking the time to participate in this course, and I hope that you learned something from it that you can utilize in your daily practice.